Medical Director of Branding.
What are basic stuff of it?
So, is that use of essence. So, the it turns out the evidence says exactly.
The actual thing is, and we have to think from every.
Journalism is all about facts and figures. And what we have been trying to do through these boot camps is actually to bring facts and figures about healthcare reporting on the ground, to make sure that people understand what's happening on healthcare. And we have been, since morning, discussing with the wonderful participants, journalists, data researchers, doctors, and it was for the first time that such a crowd came together in Nepal, and they were all willing to share skills, discuss ideas, how they can strengthen the reporting on healthcare. We heard the health minister of Nepal. He came, he participated in the debate. We had the Brad in the morning, and he was remarkable about the ideas he shared about the history of data journalism, how data tools can become useful in terms of telling stories.
Having real data and to have that efficiency to use the data to derive the information and to design your plan and interventions based on those informations is going to give you a desired result. So that was a kind of takeaway message for me.
This data boot camp helped us to understand the value of data. Though data are scattered around us, it really helped us to understand the importance. More than that, we have known how to use data in our stories, and those stories can help our readers and our policymakers as well.
Data is important because it gives us the evidences to make a decision. So we should have a good quality data where we can make our judgment decision for future treatment and future course of the healthcare. So data, I just can't explain more about data. This is the soul of the whole healthcare profession.
Anything that is out of your knowledge is useful for enhancement of growth, and these things that are particularly just focused on training a particular aspect of journalism, I think they're brilliant. This is a great exposure for our journalists as well, for journalists in all around Nepal. I think this is a great initiative and we should have more of these.
For me, it was the last session, which was, because I'm technologically inept, or basically I don't really work with technology very well, not with the times. So it was actually very interesting because I think it's something that not just journalists but also people who work in civil society, I also consider myself an activist. So these kind of tools are very useful in disseminating knowledge and information to a wider audience, which is what journalists try to do.
Data journalism is absolutely crucial these days to doing credible reporting. We have to stay up with the world. The world is running on data. We need to understand it. We need to explain it. We need to be able to analyze it and then tell a really impactful story from it.
This kind of the workshop is the base of the healthcare development of any country. Without data and without the findings, you cannot plan the health for the future. So actually we have been trying in a group, in a small group since long, but this kind of the workshop has really helped us that how the things have been going in the different parts of the world and how the data can be analyzed properly, how easy it is if you use the different tools to present the things properly, and how to collaborate with the journalists from the medical part of the view.
Best part of this bootcamp is the technical, how we can track the data, how we can clean up various data, and how we can make like an infographic, like interactive chat, and during this camp we will learn about it.
This is the first of its kind. This program is the first of its kind I have attended so far. And I did not know that how data is important. From this program, from this training, what I came to know that this type of program is very informative, and in fact it's very interactive one. And after having this training, what I learned is that how important is data.
The challenge in doing investigative journalism, including in public health and the medical field, is the issue related to data, because you need good data. Firstly, you need to find the data that is there but has not been mined. Secondly, you need to encourage those whose job it is to collect data to collect more data, because journalism cannot be very strong when you are only anecdotal. You need have a base that is based on hard data. After that, you do the human interest angle, which is where the journalist also brings in his or her skill.
When it comes to data, we journalists are faced with several kinds of data every day, and we are like in trouble, like how to present them in our publications. But I think this will help not only us journalists, but this will also is going to help the policy makers like the minister.
I think this bootcamp was really helpful, mainly to understand how we can use cold data lying on the government websites and make it actually interactive to use to make news stories. Secondly, I also actually learned different techniques, how you can make interesting interactive PPTs, how you can convert your dry data into colorful charts, and how you can make GIFs, which was really interesting, and we can impress our bosses with that.
This response today to the boot camp has been amazing. We had a great day simply because of the positive reviews that we have been receiving. We had Brant Houston, who is a founding member of the Global Investigative Journalism Network, who has been with the IRE and is actually one of the pioneers of data journalism in the world. He had a session with us where he spoke about the history of data journalism, the evolution of data journalism, and gave some really good tips to the participants who want to dabble with data journalism and healthcare.
For journalists, a lot of it can be practiced with a very basic tool, Microsoft Excel, a spreadsheet. I would say 80 to 90% of the stories being done in the world are with that particular piece of software. There's much more to do. Visualizing data with charts and maps is really important, but really if you get Excel, it's fine.
I expect that the health ministry will get a kind of report from this data bootcamp, where health ministry can also plan that what could be the next step, such that we can also contribute in creating a data community in Nepali health sector.
I think we're going to keep doing these kinds of boot camps in different parts of Asia to build this as a kind of a community around data and healthcare reporting, and so that by the next 1 or 2, 3 years we have a strong network of data journalists in Asia. We're already doing it in India, and we have done a series of successful boot camps, workshops, and we have seen more and more people coming forward and taking part in these workshops, in these training workshops and boot camps. So it's going to be a great learning for us also, because after every boot camp we try to review what we have done, the people who have participated, the feedback we are getting, so that by next couple of years we have this new initiative all across Asia, where we are all talking about facts and figures, we're all talking about attributions, we're all talking about serious journalism, we're all talking about future of storytelling.